Hi, my name is Professor Cheng Wee Ju, and today we'll be going through the various tests and treatment types available to help you through your myeloma diagnosis. Being suspected of having myeloma can be a daunting process. However, you're not alone. Here at the National University Cancer Institute Singapore, or NCIS for short, our team of specialists are committed to ensuring the best care is given to each and every patient.
Upon being suspected of having multiple myeloma, your specialist will put you through a series of tests to confirm your diagnosis, assess the status of disease, and establish a treatment plan. Tests for multiple myeloma patients fall into three main categories: blood tests, urine tests, imaging studies, and bone marrow tests. Each test can help your doctor gain more information about your diagnosis, enabling them to make tailored decisions for your care. Blood tests are essential to making a diagnosis of myeloma, while urine tests may also be required in some circumstances. Specifically, we are looking for low levels of blood cells, kidney dysfunction, and raised calcium in the blood. The blood tests can also detect abnormal proteins produced by myeloma cells. In addition to blood tests, we may also perform X-rays or scans to look for bone damage from the myeloma. Your doctor will provide you more information on the tests you need to undergo, as well as specific instructions to follow before you do the test. After completing your tests, your doctor will discuss the results with you in more detail and explain the next steps, which may include a bone marrow test. Bone marrow tests are essential in the diagnosis of myeloma. Bone marrow is the sponge-like tissue found inside the body's larger bones, comprising various types of blood cells, including plasma cells. As the abnormal plasma cells in myeloma grow inside the bone marrow, a bone marrow examination is crucial in the testing process. Typically, bone marrow aspiration is performed first. A hollow aspirate needle is inserted through the skin, then through the bone into the bone marrow. Once the needle is in the cavity, a syringe will be attached to the needle to withdraw a sample of the liquid bone marrow. Subsequently, a biopsy will be performed if required. In a biopsy, a larger needle will be advanced further inwards and rotated to obtain a cylindrical piece of bone marrow about 1 centimeter long. After the procedure, a bandage will be placed over the site to prevent bleeding. You will be asked to lie on your back for some time and apply pressure to the procedure site. Thereafter, assuming that no bleeding is observed, you can then get up and go about your normal activities. Paracetamol or other painkillers can be used to ease the soreness, which is common 2 to 3 days after the procedure. Any worsening pain, redness, fever, bleeding, or swelling may suggest a complication. You should also avoid washing the procedure site for at least 24 hours to keep it clean and dry. Now that testing and diagnosis are complete, let's look at some treatment options.
These days, patients with multiple myeloma have many treatment options. Patients with active, symptomatic, multiple myeloma or asymptomatic, smoldering multiple myeloma with one or more myeloma-defining events will need to begin treatment. There are many different classes of drugs that are used for treatment. There are proteasome inhibitors, immunomodulatory drugs, steroids, export inhibitors, monoclonal antibodies, antibody-drug conjugates, chemotherapy agents, and immunotherapies. Induction therapy aims to effectively control and destroy multiple myeloma cells while reversing myeloma-related complications. Another standard course of treatment is a stem cell transplant to provide new, healthy cells from a donor referred to as allogeneic or from their own blood referred to as autologous. High-dose chemotherapy combined with autologous stem cell transplantation is now a standard therapy for patients with multiple myeloma after induction therapy. Compared with chemotherapy alone, a stem cell transplant can provide significant remission. Overall survival and progression-free survival of patients are prolonged by several years. However, it does not cure the cancer, which can sometimes return. There are a total of 4 steps in stem cell transplantation. Step 1 involves stem cell mobilization. In stem cell mobilization, stem cells are transported from the bone marrow into the bloodstream, where they can be easily collected. Step 2 is stem cell collection, also known as apheresis. This process is carried out via a central venous catheter, which is inserted through the skin into a large vein near the groin or forearms. The patient's blood is then passed through an apheresis machine, which removes the stem cells before returning the blood to the patient's body. This process takes 4 to 6 hours per session, and patients may require several sessions to collect adequate numbers of stem cells. Step 3 is conditioning, where high-dose chemotherapy is administered to the patient to destroy as many cancer cells found in the body as possible. Lastly, Step 4 is a stem cell infusion. The stem cell infusion process is similar to that of a blood transfusion. Bags of stem cells are infused into the patient through a vein over the span of 1 to 2 hours. Like all forms of treatment, there are side effects to stem cell transplantation, which are similar to those of chemotherapy but can be more severe. Low blood counts after transplant mean that the immune system is weakened, so the patient is at serious risk of infections and bleeding. Hence, it is necessary to practice good hygiene and minimize exposure to bacteria or viruses post-transplant. However, autologous stem cell transplant in myeloma is a relatively safe procedure. In NCIS, patients have the opportunity to undergo the autologous transplant in an outpatient setting, provided they have good caregiver support. You will be monitored closely by your doctor post-transplant to keep a close eye on your progress and treat any complications early. Apart from drugs and stem cell transplantation, patients can also consider immunotherapies such as CAR-T therapy and BiTE therapy if available. Chimeric antigen receptor T-cell or CAR-T therapy is a type of immunotherapy that helps the patient's own immune system target and kill cancer cells. CAR-T therapy is also a type of cell-based gene therapy because it involves altering the genes inside specific immune cells to help them attack the cancer. When a patient is undergoing CAR-T therapy, immune T-cells are removed from the blood and genetically altered in a laboratory, so that they have specific receptors on their surface that attach to cancer cells. The T cells are multiplied and inserted back into the patient's blood to seek out the cancer cells and help the immune system attack them. This treatment can have serious side effects, so your healthcare team will watch you closely for several weeks after therapy. Bispecific T-cell engager or BiTE therapy is a new immunotherapy approach that helps the patient's own immune system target and kill cancerous multiple myeloma cells. BiTEs are a type of modified antibody with 2 arms. One arm of the antibody attaches to a specific protein on the cancer cell, while the other arm attaches to T cells and activates the patient's immune cells to kill the cancer cell. BiTE therapy is different from CAR-T therapy, as the product is directly administered to the patient. It does not require T cells to be extracted from the patient for genetic alteration. As with CAR-T therapy, there are several BiTE antibody products, and your doctor will explain which is suitable for you. Another viable option for multiple myeloma patients are clinical trials that are exclusively available at NCIS. To find out more about your eligibility for these trials, let's speak to Professor Cheng, who will take us through what clinical trials are and why they can be beneficial for you.
In general, clinical trials are research studies of new treatment in people with serious diseases such as cancer. Clinical trials are designed to assess if a new medication is safe and effective for a specific disease, if a current medication is safe and effective for a new indication, and if new treatments are better than available standard treatments. Your doctor may ask you if you would like to participate in a multiple myeloma clinical trial when appropriate. Each trial has its own set of criteria to determine a participant's suitability. The most common criteria used to determine suitability for participation are age, gender, type and stage of disease, treatment history, other medical conditions, and current medications. If you choose to participate in a clinical trial, you may be one of the first few patients to benefit from a new treatment method. You have the opportunity to contribute to the future of science and the treatment for multiple myeloma. Should you be offered the opportunity to partake, a doctor and a clinical research coordinator will explain the risk, benefits, and the process of the trial to you in greater detail. After stem cell transplant, some patients may be given additional cycles of chemotherapy. This is known as consolidation therapy, which aims to further reduce the disease and help achieve a complete treatment response. As myeloma is incurable, all patients will be given long periods of low-dose treatment, sometimes for years, usually involving lenalidomide, bortezomib, or thalidomide. This is called maintenance therapy, and the aim of this is to delay potential disease relapse. Vaccinations are essential as patients with multiple myeloma have an increased risk of infections. Patients usually have weakened immune systems from the growth of the cancer cells in the bone marrow, compounded by immunosuppressive effects of active chemotherapy and radiation therapy. It is therefore considered particularly important to vaccinate myeloma patients against frequently encountered pathogens after treatment. However, you should not have immunizations with live vaccines while having cancer treatment and for some time after. Patients who have completed cancer treatment face a new chapter in their journey with multiple myeloma. Your healthcare team will be at hand to help you at every step of the way. There are many dedicated programs available for patients at various stages. From support groups to having a dedicated nurse navigator to being referred to a survivorship service, nobody at NCIS gets left behind. We hope this deep dive into your myeloma journey has provided you with the insights as to what you can expect for the next few years. While the path ahead may appear daunting, rest assured that our team will be alongside you on this journey in every step of the way.